guys, this is Laurence, Mickey, and Jennelle again. As today we're going to talk about C-section because a lot of you guys can pass through all those experiences and we want to make sure you're ready to go. So when you're ready, mademoiselle.
All right, so I think it's really important to understand that a C-section or a surgical birth is possible with every delivery. And that's not to scare someone, that's to make you prepared and feel that you're owning your birth story regardless of how we end up with a healthy mom and a healthy baby. So as a postpartum doula, I tell all of my pregnant women, just prepare for one. And that means having things at waist height. You don't have to get on the ground to be looking for receiving blankets and baby socks. You're not reaching up and grabbing towels off the top shelf. Everything in your home is kind of at waist height, and maybe in one room you're going to utilize them most. Doing stairs after surgical birth is pretty intense and painful, and you don't want to do it 16 times a day. Maybe once or twice a day if that's where your bedroom is, but the rest of the day you're staying downstairs. So pre-planning this doesn't mean you're manifesting it. It means you're prepared for anything and that you'll walk out of the hospital just as excited about how your baby came into the world as you did going in. So for me, that's a really important piece of healing from pregnancy. I had 2 C-sections. My daughter was breech and they wanted to do an inversion, which back in the day, 2001, I did some research on dial-up internet and that didn't look like a good option for us. So we opted for the C-section and I had no idea what was going on. So my recovery, again, no, wasn't a personal trainer at the time, no idea. Hey, 6 weeks, you're healed. You're not healed, ladies. You may feel better. Your scar may be closed. You are not healed. So I have a little diagram of what actually happens. It might be a glare. We'll see. All right. So they cut through 7 layers. 7 layers are disturbed and disrupted. The top layer is skin. Then they go ahead and cut your fat. The rectus sheath actually holds your rectus abdominis together. It's like a bag outside of meat. So they cut that so that the muscle is controlled. And then they try not to cut the rectus abdominis. They try to separate it. So they're going with the grain and pushing it forward and back, pushing it forward and back, trying to get a pocket big enough to deliver this 6, 7, 10-pound baby. And then they will go through the peritoneum. And then very last, we have the uterus, which is a very dense, thick muscle. And they're also cutting that. So I had 2 C-sections, which means I have 1 scar on the outside, 1 scar in my skin. But then when they entered all the other layers, they had to choose another access point because they don't want to go through scar tissue. So my uterus actually has 2 scars, and I have to be cognizant of that as well. So my son was delivered 60 weeks after my daughter, and because that's really close, they didn't want me to have a uterine rupture, so they opted for a C-section on him as well. Decades later, I had an appendix removed. They used my C-section scar. That's now 3 times my scar has been accessed. So 1 superficial scar, now 3 times penetrated on the inside, and then donated my kidney to my husband 5 years ago. And they used my C-section scar. So that comes up with the 9 wounds in my abdomen, 1 superficial C-section scar, but 4 access points beyond that with all the laparoscopics as well. So knowing what happens, you can't feel it. You can't see it. They put a screen up, you're on IV, you feel pressure, like someone's pushing on you a little bit. You're not really sure what's happening. And they're going through all those layers. They're opening up the uterus. They're reaching in, pulling baby out and getting them oxygen as fast as they can. Sometimes your partner can observe. Sometimes you're going to ask them to sit down and be quiet. So you get to be in charge still, even though they're doing the surgery. You get to be in charge of how the other people experience it with you. If baby comes out pink and happy and healthy and crying, it usually comes to your chest right away. A few minutes of bonding, and then they take it away and do tests on it. If there's some moments, maybe there was an emergency C-section for a health reason, you might not see baby right away up front, and that's okay. They're doing everything they can both for you and the baby at the same time, and you just need to trust the process because their goal is healthy mom, healthy baby. All right, so this portion of the video, we're going to talk about Diastasis Recti. It is the separation of the abdominal muscles. It's quite natural that there is some movement when we grow a baby. We need to expand, things need to happen. Down the very center, this is a very colorful design of your abs. Down the very center is connective tissue called the linea alba. Connective tissue doesn't stretch very well. It behaves a bit like a bone or like scar tissue. So then the muscles around it are going to move around as well. They move a lot easier. So in a normal, typical, we can put 2 fingers between the ab muscles and feel them on each side, pinching the fingernail and then the fatty tissue of my fingertip. That would be a very typical separation. We all have it. That's where the linea alba is running. As baby grows and we start pushing, diastasis recti is when this separates. So it usually happens around the belly button above and below. And depending on how big this gets, depends on how problematic it is. So post-delivery, we want this to come back together. We want to be able to get back to just one finger width in between here, but it takes time. So if you've had a little bit of a separation at your 6-week, your 12-week check, they're going to be seeing, are you 2 fingers? Are we 1 finger? How's that going? But if you can get 3 or more fingers in there, we're probably looking at surgery of some sort is the recommendation. I would recommend that you also talk to pelvic floor physical therapists and personal trainers, because there are ways to help bring this back together without necessarily having to go in and mesh it with surgery. So we want surgery to be the last step. If someone's recommending it, I would say get a couple of opinions. So the idea is that the body naturally comes back together, holds this together. But if it's blown out, that's where you get the doming. When you get into like a partial crunch, the doming, because organs are pushing through, there's nothing to restrain them. And so they're bulbing. So we'll undress Laurence, because this is strange and weird, but it was a very good visual for you. And we're going to put Laurence on her back. So the test for diastasis recti is she's in the perfect position. And we want you just to curl your shoulders up a little bit, and I palpitate. So she has what is considered a typical separation of the abs where that linea alba is running. Go ahead and relax. Now, if she had doming, it would physically push her shirt up when she goes into that crunch position, and it feels like jello. It feels soft and gooey and not great at all. Go ahead, relax. So again, you can do it to yourself. We're going to take your hand, Laurence, and you're going to put it in that way. Exhale, come up and do just a bit of a crunch, and see if you can palpitate the muscles on the fingernail and the palm side.
Yeah.
Nice. So that's a good way to self-check. Of course, fresh after delivery, it's a lot wider. It might be 2 or 3 fingers. But as the weeks pass, this should be getting smaller. If it's not, you need intervention. Nice. All right, so at home, if you're suspecting you've got a little bit of DR going on, you want to see if there's some things you can do for yourself. What we have here is just a towel folded in half a couple of times so it's nice and long. Laurence has grabbed opposite ends, and as she exhales, she's going to give herself some tension. This is under the rib cage, above the pelvis, and then when she inhales, she'll let her shoulders relax, but try not to bag out through the abdomen. You want to just maintain some tension there. And then exhale, cinch sack that in, help with the towel. We're bringing the abs forcefully together with the towel, but then keeping the mind-body connection to try and keep them there. You can do this 10 to 12 times a day, in the morning, at night. See how it feels. We're not trying to rip things apart here. We're not being super women with our arms and giving ourselves shoulder cramps. We're just encouraging the muscles to get a little closer together. How does this feel?
Feels good.
Yeah, nice.
Yeah.
It's good to have the feedback. The brain needs to understand what it means to bring it all together.
Yeah, so biggest takeaway, prep yourself. It is not manifesting, it's not expecting it to happen, it's just prepare yourself. But even for somebody who didn't have a C-section, I wouldn't even have thought to prep my home and having everything at counter height. So, because even if you just have stitches, it's very uncomfortable moving around, grabbing things sometimes. You're in pain, it's swelling, it's discomfort. So even just prepping yourself for the idea that this might happen, just so when you do come home, you're not panicked that you can't do anything. Or even if you're a single mom and you have to come home solo, you have to have the home prepared to make sure that you are going to be at your best. You're going to be achievable at those first few weeks, because they're emotionally draining, they're emotionally exhausting. Yes. So just prep yourself. Then that's one less thing you have to think of.
If you get rid of the unknowns, it makes it a more enjoyable experience. You'll enjoy those first few days and weeks with baby a lot more than having all these unknowns in your head and in your home.
And the thing I want to share here, I'm not a mom yet, but the thing I saw a lot with like new mom is like having a C-section, it's not a failure, it's actually like the best thing for you or your baby, and having like a natural delivery is great, but a C-section is great because as a woman, you just create someone, a little things, a little cute little baby. That is the magical about your body. And just think about it, you still are amazing if you still have a C-section. I see too much often women who really beat themselves up because they have a C-section. But you know what? It's just amazing how your body can be. And now we have Jennelle with all her tools to help you guys to just moving forward. And you know, you're still amazing if you have a C-section or not, you know.
I had a postpartum client once who was very distraught that she had to have a surgical birth. And I described it in such a way that, let's say you're going on vacation and you've packed your bags, you're going to Spain, you get off the plane and you're in Iceland. You can still really enjoy yourself. You may not have the right things with you at the time, but you can really enjoy the experience. And you're not in control. You know, no one is in control during these moments. So if you're just prepared to enjoy whatever the process is, it tells a much happier story. So yeah, less to heal from.
We hope that helped you out today for just prepping your own self for going to the hospital with baby. So these are just some different tips, tricks, ideas that you can have just getting yourself ready to get ready for that birth.
Yay, baby.
I hope you enjoyed that video. Give us your thoughts, and if you have any question about like C-section, we're gonna be waiting to respond to the question. And see you for the next one, guys. Ciao, bye.
Bye.